Previous year nursing exam MCQs. The normal respiratory rate of an adult is 12 to 20 per minute. The normal pH of arterial blood is 7.35 to 7.45. Which vitamin is essential for blood clotting? Vitamin K. The first heart sound is produced by closure of mitral and tricuspid valves. The most common site for intramuscular injection in adults is ventrogluteal. Which cranial nerve is responsible for vision? Second, optic nerve. The antidote for opioid poisoning is naloxone. The normal platelet count is approximately 150,000 to 450,000 per cubic millimeter. Which electrolyte is mainly found inside the cells? Potassium. The Glasgow Coma Scale assesses level of consciousness. The maximum score of the Glasgow Coma Scale is 15. The vaccine given at birth to prevent tuberculosis is BCG. Which blood group is considered the universal red cell donor? O negative. Which blood group is the universal plasma donor? AB. The normal urine output of an adult per day is approximately 1 to 2 L. The normal fasting blood glucose level is approximately 70 to 99 milligrams DL. Which insulin has the most rapid onset among commonly used insulins? Lispro. A patient with hypoglycemia who is conscious should initially receive fast-acting carbohydrate. The antidote for heparin overdose is protamine sulfate. The antidote for warfarin overdose is Vitamin K. Which position is commonly used to improve oxygenation in a conscious patient with breathing difficulty? High Fowler's. The best method to prevent hospital-acquired infection is hand hygiene. Sterilization by steam under pressure is called autoclaving. The standard autoclave temperature at 15 psi is approximately 121 degrees Celsius. Which organism causes tuberculosis? Mycobacterium tuberculosis. The incubation period of measles is approximately 10 to 14 days. The characteristic rash of measles usually begins on the face hairline. The normal APGAR score is assessed at 1 and 5 minutes. The maximum APGAR score is 10. The first milk secreted after childbirth is called colostrum. Colodrum is particularly rich in IJ. The normal duration of pregnancy is approximately 40 weeks. The most common cause of postpartum hemorrhage is uterine atony. The drug commonly used as a uterotonic for prevention treatment of uterine atony is oxytocin. The normal fetal heart rate is approximately 110 to 160 per minute, which is a classic sign of increased intracranial pressure. Bradycardia with hypertension. The most common type of stroke is ischemic. Parkinson's disease is primarily associated with deficiency of dopamine. The classic symptom of appendicitis is pain that typically localizes to the right lower quadrant. Common electrolyte abnormality in severe vomiting is hypokalemia. The most appropriate diet for a patient with hypertension is low-sodium diet. Which organ is primarily responsible for insulin production? Pancreas. The functional unit of the kidney is nephron. The main function of hemoglobin is to transport oxygen. The safest action before administering medication is to check the medication order and patient identifiers. Which route provides the fastest systemic drug action? Intravenous. The antidote for benzodiazepine overdoses. Flumazenil. In CPR, the recommended adult chest compression rate is 100 to 120 per minute. In adult single rescuer CPR, the compression to ventilation ratio is 30 to 2. Thanks for watching.